How to spot 10 signs of borderline personality disorder. Borderline personality disorder, BPD, is a mental illness that is characterized by instability in moods, behavior, self-image, and interpersonal relationships. BPD patients may experience intense periods of rage, depression, and anxiety that last from a few hours to several days. Borderline personality disorder is also difficult to spot. This is because the symptoms can vary widely from person to person and can be easily mistaken for other mental health conditions. It can be a very difficult condition to manage, but there are treatments available that can help. If you are concerned that you or someone you know may have BPD, it is important to be aware of the signs and symptoms of the disorder. In this video, we will go over 10 signs of borderline personality disorder. By understanding these signs, you can get the help you or your loved one needs to manage the condition. So watch till the end, and if you haven't liked the video yet, be sure to like it and subscribe to our channel so you don't miss any further videos. Here are the 10 signs of borderline personality disorder. Number 1. Unstable or intense relationships. An individual with borderline personality disorder may have intense and unstable personal relationships. These relationships are often characterized by their stormy nature, full of highs and lows. Individuals with BPD may feel that their partner completes them and they cannot imagine life without them. Also, they may idolize someone one minute and then feel betrayed or abandoned the next. This can lead to a pattern of distancing oneself from others, followed by intense neediness and clinginess. However, their partner may also be the source of all of their problems. Individuals with BPD may swing from seeing their partners as perfect to seeing them as evil. Such intensity and instability in personal relationships are one of the most significant signs of BPD. While the symptoms of BPD can be difficult to cope with, there is hope. With treatment, many people with BPD can manage their symptoms and live fulfilling lives. If you are concerned that you or someone you know may have BPD, if you're not sure, it's important to seek professional help. A trained mental health professional can help you and your partner understand and manage your symptoms. Number 2. Unstable sense of self. An unstable sense of self is one of the hallmarks of borderline personality disorder. Individuals with BPD often have difficulty regulating their emotions and may experience extreme changes in their mood, self-image, and behaviors. This can lead to a sense of instability and chaotic relationships. BPD can be a very difficult disorder to live with. Those who suffer from BPD often feel like they are on the edge of a cliff, not quite sure if they will survive another day. The constant feeling of being on the verge of disaster can be extremely taxing both emotionally and mentally. Many people with BPD may feel like they are walking on eggshells, never quite knowing when something will trigger a meltdown. Living with BPD can be an incredibly isolating experience, as many people are afraid to get too close to someone with the condition. If you or someone you know has BPD, it is important to seek professional help. There are treatments available that can help to stabilize the person's sense of self and improve their quality of life. Number 3. Impulsivity. Patients with borderline personality disorder frequently exhibit impulsive behaviors such as spending large sums of money, engaging in risky sexual activity, or drug abuse. This impulsive behavior is often a sign of underlying distress and may be a way for patients to cope with difficult emotions. While impulsivity is a common symptom of BPD, it is important to note that not all impulsive behaviors are indicative of the disorder. For example, someone with BPD may be more likely to act on impulse without thinking about the consequences, whereas someone without the disorder may be more likely to act impulsively but still be able to consider the potential outcomes of their actions. If you or someone you know is exhibiting signs of impulsivity that are causing significant disruptions in their life, it is important to seek professional help. BPD is a serious condition that can be effectively treated. Number 4. Self-harm or suicidal behaviors. While self-harm and suicidal behaviors are often seen as signs of mental illness, they can also be indicative of borderline personality disorder. A borderline personality disorder is a mental illness characterized by impulsivity, mood swings, and difficulty regulating emotions. Individuals with borderline personality disorder often engage in self-harm or suicidal behaviors as a way to cope with their intense emotions. This can be a very dangerous symptom of the disorder, as it can lead to serious injury or even death. If you or someone you know is engaging in self-harm or suicidal behaviors, it is important to seek professional help immediately. If you or someone you know is engaging in self-harm or suicidal behaviors, it is important to seek professional help. Borderline personality disorder is a serious mental illness that can be difficult to treat, but there are treatment options available that can help you manage your symptoms and live a healthier life. Number 5. Chronic feelings of emptiness. Emptiness is a feeling we all experience at one point or another in our lives. But for some people, this feeling is chronic and can be a sign of a serious mental health condition called borderline personality disorder. People with BPD often feel like they are empty inside. They may feel disconnected from themselves and the world around them, and they may have a hard time forming close, meaningful relationships. BPD is a complex disorder that involves a mix of emotional, social, and behavioral problems. Chronic feelings of emptiness are a sign of borderline personality disorder, which is a mental health condition that is characterized by instability in moods, behavior, and relationships. Individuals who suffer from borderline personality disorder often experience chronic feelings of emptiness. This can be incredibly distressing and lead to several other problems such as depression, anxiety, and self-harm. If you are struggling with chronic feelings of emptiness, it is important to seek help from a mental health professional. With treatment, it is possible to manage your symptoms and live a fulfilling life. Number 6. Explosive anger. Anger is a normal emotion that most people experience at some point in their lives. But for some people, anger can be much more than just a passing emotion. For people with borderline personality disorder, anger can be intense, explosive, and hard to control. While explosive anger is not always a sign of BPD, it is one of the most common symptoms of the disorder. Explosive anger is a hallmark symptom of borderline personality disorder. Individuals with BPD often have difficulty regulating their emotions, which can lead to outbursts of anger. These episodes of anger may be directed at others or may be self-directed. If you or someone you know has BPD, it is important to seek professional help. With proper treatment, people with BPD can learn to manage their emotions and live healthy, productive lives. Number 7. Paranoia or dissociation. People with borderline personality disorder often experience paranoia or dissociation. These symptoms can be mild or severe, and they can come and go over time. Paranoia is a feeling of intense suspicion or mistrust. It can cause a person to feel like they are always being followed or watched. Dissociation is a feeling of disconnection from oneself or the world around one. Someone may feel like they are outside of their body or like they are watching themselves from a distance. These symptoms can be extremely distressing and can make it difficult for a person to function in their day-to-day life. If you or someone you know is experiencing paranoia or dissociation, it is important to seek professional help. Number 8. Subtle forms of self-destructive behavior. It is not uncommon for people with borderline personality disorder to engage in self-destructive behaviors. While these behaviors can take many different forms, they all share a common goal: to relieve the pain and sense of isolation that people with BPD can feel. Self-destructive behaviors are often a way for people with BPD to cope with their intense emotions. They may help to numb the pain of feeling like loneliness, abandonment, and insecurity. In some cases, self-destructive behaviors may also be a way to release built-up anger or resentment. While self-destructive behaviors may provide temporary relief, they ultimately do more harm than good. If you or someone you know is engaged in self-destructive behaviors, it is important to seek professional help. These behaviors can be incredibly damaging to both physical and mental health. Number 9. Extreme reactions to real or perceived abandonment. Abandonment issues are often thought of as a sign of weakness, but they can be a sign of serious mental health condition called borderline personality disorder. People with BPD often have extreme reactions to real or perceived abandonment, feeling abandonment even when there is no evidence of it. Also, BPD is a complex mental health condition that can be difficult to understand, but it's important to be aware of the signs and symptoms. While it is normal to feel upset when faced with abandonment, people with borderline personality disorder often have extreme reactions to real or perceived abandonment. These reactions can include feeling hopeless, helpless, and worthless. People with BPD may also experience intense anger, depression, and anxiety. If you or someone you know has these reactions to abandonment, it may be a sign of BPD. If you think you or someone you know may have BPD, it is important to seek professional help. There are treatments available that can help manage the symptoms of BPD. Number 10. Extreme emotional swings. Borderline personality disorder is a mental illness that is characterized by extreme emotional swings, impulsive behaviors, and chaotic relationships. People with borderline personality disorder often feel like they are on the edge of a precipice, teetering between two worlds. They may be in a good mood for 1 minute and then suddenly feel like they're about to fall into a deep depression. People with BPD often have difficulty regulating their emotions, which can lead to risky behaviors, self-harm, and even suicide. This can make it very difficult for people with BPD to function in their day-to-day lives. If you or someone you know is experiencing extreme emotional swings, it is important to seek help from a mental health professional. BPD is a treatable disorder, and with the right help, people with BPD can lead full and fulfilling lives. Spotting the signs of borderline personality disorder can be difficult. However, some telltale signs can be indicative of the disorder. If you suspect that someone you know may be suffering from a borderline personality disorder, it is important to seek professional help. Therefore, with the right treatment, people with BPD can learn to manage their emotions and live healthy, productive lives. If you enjoyed the video, be sure to like and subscribe to our channel so you don't miss any future videos. Thanks for watching.